Good morning and welcome. Today, we're diving into an exciting and important topic: adaptive assessments for intellectual disabilities. We'll explore innovative approaches and cutting edge technologies that are transforming how we evaluate and support individuals with intellectual disabilities. Our focus will be on personalized care and intervention, aiming to make a real difference in lives through smarter, more tailored assessments. I'm looking forward to sharing these insights with you. Let's get started. Let's begin by defining what adaptive assessments are. These are tests that change in real time based on how the person is answering. If the questions are too easy or too hard, the test adjusts, creating a personalized evaluation that's more accurate and fair. Next, when we talk about intellectual disabilities, we're referring to notable challenges in cognitive functioning and everyday skills, which can affect learning and daily activities. The key point here is that adaptive assessments are specifically designed to match the unique abilities and needs of individuals with intellectual disabilities, helping us better understand their strengths and areas where they might need support. This foundation is crucial as we explore how these assessments can be most effective. Adaptive assessments are crucial because they offer a much more accurate way to evaluate individuals with intellectual disabilities. By adjusting the difficulty of questions to match the person's ability, these assessments help minimize frustration and prevent cognitive overload, which can often skew results. This tailored approach not only reduces stress, but also keeps the individual more engaged throughout the process. Another key benefit is that it supports more precise educational and clinical planning, allowing interventions to be better aligned with each person's unique needs. Ultimately, adaptive assessments lead to better overall outcomes by enabling more effective, individualized support. When we compare traditional and adaptive approaches to assessments, one key difference stands out: fixed versus dynamic questioning. Traditional assessments present the same set of questions to everyone, no matter their ability level. This can lead to inaccuracies and cause test takers to feel disengaged. On the other hand, adaptive assessments adjust the difficulty of questions on the fly, based on how the individual responds, making the process more personalized. This dynamic approach also impacts both measurement precision and engagement. Because traditional tests are fixed, they may not accurately capture a person's true abilities and can feel monotonous. Adaptive assessments, by tailoring questions in real time, offer much higher precision in measuring skills. They also keep test takers more engaged and provide a clearer, more accurate picture of each individual's functional level. This is especially crucial when assessing people with diverse cognitive profiles, such as those with intellectual disabilities, where a one-size-fits-all test simply doesn't work well. Adaptive testing relies on several key technologies that work together to create a personalized testing experience. First, we have computerized adaptive testing, or CAT. This technology selects questions in real time based on how the test taker is performing, ensuring that each question is neither too easy nor too hard. Next is item response theory, or IRT, which is a mathematical model behind this process. IRT helps us understand the relationship between the difficulty of each item and the ability level of the examinee, allowing the test to adapt accurately. Finally, dynamic assessment plays a crucial role by providing ongoing feedback during the test, continuously adjusting the testing process to better measure the individual's true ability. Together, these technologies make adaptive testing both efficient and highly effective. When developing adaptive assessments, one of the primary challenges is addressing accessibility. It's crucial that these assessments are usable by individuals with a wide range of disabilities and language backgrounds, ensuring everyone has equal opportunity to demonstrate their knowledge. At the same time, maintaining fairness and validity is essential. We need to make sure that the assessments provide accurate results across diverse populations without bias. Another major challenge lies in managing the technical complexities involved in designing, deploying, and calibrating adaptive tests. These processes require sophisticated systems and expertise to function smoothly. To successfully overcome these barriers, implementing inclusive design principles becomes a key strategy. This means carefully standardizing procedures and creating assessments that accommodate all users effectively. Finally, all of this depends on having a strong technological infrastructure in place. Without robust systems supporting the assessments, it's impossible to achieve reliability and consistency in results. Let's look at some real-world applications of adaptive assessments. First, in the evaluation of intellectual disabilities, these assessments have shown clear benefits by tailoring the process to each individual's needs. Then, the computerized versions of the Vineland Adaptive Behavior Scales have made assessments more efficient and accurate, helping professionals gather better data more quickly. Research studies back this up, showing that adaptive assessments lead to improved diagnostic accuracy and enable more personalized support, whether in schools or clinical settings. Ultimately, these tools provide actionable insights that help us design interventions specifically suited to each person, making a real difference in their outcomes. When we look ahead to the future of adaptive assessments, one of the most exciting developments is the integration of artificial intelligence. AI allows us to customize tests in real time, tailoring the experience far beyond what's currently possible. This means assessments can adapt instantly to the individual's responses, making them more accurate and personalized. Another breakthrough comes with wearable technology. By integrating these devices, we can continuously monitor cognitive and adaptive behaviors in real-world settings, giving us a much richer and more dynamic picture of a person's abilities. Alongside this, advanced data analytics will play a crucial role. These tools will help us analyze assessment data with greater precision, uncovering deeper insights that enable even more personalized evaluation and support. Altogether, these innovations have the potential to transform how we evaluate and support individuals with intellectual disabilities, making assessments more responsive, comprehensive, and ultimately more effective. To wrap up, adaptive assessments represent a significant step forward in how we evaluate intellectual disabilities. They provide a more tailored and precise approach, which helps us better understand each person's unique needs. This leads directly to more personalized support as these assessments adjust to an individual's abilities, allowing educators and clinicians to offer interventions that truly fit. Looking ahead, ongoing innovations and the integration of new technologies promise to make these tools even more effective, improving personalized care and outcomes for those who rely on them.